Hello, everybody, and welcome to my essential oil safety training. My name is Katrina Dow, and I am a certified aromatherapist, as well as the owner of my own company, Bodhichakra Aromatherapy. If at any point during this presentation you do have any questions regarding what we're talking about, or if you just have an additional question that I might have forgot to include, then you can go ahead and comment something down in the comment section of this video, or you can contact me at bodhichakraaromatherapy@gmail.com. I would also like to add that once you have access to this workshop through Eventbrite, you will only have 3 hours to access it and complete it. However, if you would like to save the link, you will have lifetime access to this presentation for future reference. But if you do not save the link to this presentation, you will lose access after 3 hours. And again, if you're having any issues accessing the presentation, or you, for example, just missed the window for the presentation, but you did pay for it, please contact me at bodhichakraaromatherapy@gmail.com, and I will send the presentation to you, which you will have lifetime access to as well, as long as you save the link, because it is a private link. But anyways, let's get into our presentation. So because this is a presentation on essential oil safety, this will be the only slide I'm providing that will be based on like the basics or introduction to essential oils. So if you would like to learn more about how essential oils work and how they're extracted, different methods and things like that, I suggest you take our other workshop at Introduction to Essential Oils, which can also be found on Eventbrite. Now, what are essential oils? So, essential oils are very highly potent extracts from plants. They can be extracted from flowers, leaves, resins, barks, roots, branches, seeds, or fruits. They are chemicals, okay? So they are aromatic hydrocarbons, both terpenoid and non-terpenoid. And there are different methods of extracting essential oils from plants, and that would be through steam distillation, solvent extraction, and cold press. Those are the most common, steam distillation and cold press being the most common, but there is also solvent extraction. And then on top of the methods of essential oil extraction, there's also different methods for how to use them for your body or for your home, etc. So the most common methods are inhalation, diffusion, topical use, and internal. Now, I've put internal here in red because this is something you should never ever do. Do not ever ingest essential oils. I don't care if you're hearing it from essential oil companies who are marketing them as safe and natural. I don't care. Do not put them in your body. You can get very, very sick and possibly die from ingesting essential oils, and I'm going to be going through some of the risks later on in this presentation, so just stay tuned. But just for now, no, never ever do that. Now, like I said before, essential oils are chemicals, so they should be treated as such. If you're using very potent essential oils for your business, you should definitely be using PPE such as gloves, or if you're not working in a ventilated area, you should probably be using a respirator. Not even going to lie to you. Now, I'm sure we've all taken Wimmis before at some point in our lives, so you probably recognize the symbols here on the left. I just want to briefly go over some of the hazards associated with essential oil use. So they are highly concentrated, which means they are very potent chemicals and will have strong effects, like skin irritation, sun sensitivity, which, by the way, can cause 2nd and 3rd degree burns, flammability, and also hormonal imbalance. Now, I'm going to be going over the hormonal imbalance near the end of the presentation, just because I have a couple examples of like male versus female and how certain essential oils affect different sexes. So, like I said before, essential oils are chemicals. So when using essential oils, you should consider the following. You should consider your age, because children are much more sensitive to essential oils. Elderly people have much thinner skin. And because they are chemicals, they should be treated as like any other medication. So you should be consulting your doctor if you are taking any other medications or supplements, because they might have counteractions. You should also be concerned with any underlying health conditions you may have, such as any respiratory conditions you might have, as well as dermatological conditions. Now, the chemical composition and purity of essential oils is important. You should never be using any essential oil that is less than 100% pure. If you are using essential oils that are any less than 100% pure, you really don't know what they are mixing it with. And as essential oils are already very potent chemicals with a lot of counteractions, you don't want to be mixing anything you might be unknown to. And you should also be concerned with the method of use. So are you applying it topically? Are you diffusing it in your home? Things like that, because they do have different counteractions. And like I said before, dosage, you should treat essential oil like any other medication. So obviously, don't be layering it on every 20 minutes. Give your skin a break. And I'll be going over how to use a diffuser as well. So how do we use essential oils safely? Well, you should never ever apply pure essential oil directly to your skin. You never know how it's going to react. That being said, you should always use a 2% dilution concentration for your essential oils. And yes, there will be an incoming math lesson. It'll be quick and almost painless, I promise. And also, I just want to say, I know I said never apply pure essential oil directly on your skin. This goes without saying, of course, but you should always, if you're going to be doing this, you should do a patch test, which we will be going over a few slides from now. Also, you should avoid sun exposure for 2 hours after skin application, especially for certain essential oils that are photosensitive, like citruses, like orange and lemon, bergamot, etc. You should always store your bottles in a cool, dry place. And it's always a good start to participate in an essential oil safety course, and that is why you're here. Now, like I said before, you should always dilute your essential oils when you're using them topically. The rule of thumb is to dilute essential oils to 1% for children and 2% for adults. You should always perform a patch test before using these routinely, and you should use extreme caution with photosensitive oils, such as those citrus oils that I had mentioned earlier. Because if you put these oils on your skin and then go outside and tan or get a sunburn, you could end up with second and third degree burns from the topical use of certain essential oils. Now, if this does happen, you should obviously seek medical attention for these severe side effects, as well as if you are experiencing any contact dermatitis with open lesions. Now, I'm just going to briefly go over how to perform a patch test. If you've ever been allergy tested before by a doctor, it's very, very similar. You can do it on your forearm. So you're going to wash your forearm with unscented soap and pat dry. Then you're going to apply 1 drop of essential oil onto your arm. And if you're doing multiple essential oils, you should probably label it like the photo here and mark it. And this is what the dermatitis will look like if you are having a reaction. Now, once you've applied the drop of essential oil onto your arm, you're going to rub it in a very, very small patch about the size of a dime. Then, once you're finished applying all your essential oils, labeling them, whatever, you're going to wrap it gently with gauze. You're going to wait 24 hours, and then you're going to remove the gauze and observe for any concerning changes, such as these inflamed spots of contact dermatitis. And of course, if you have a positive reaction to any of these patch tests, you should know that you shouldn't be using these on your skin, especially in pure quantities. All right, now here is that very painful math lesson I told you was coming. So when we're talking about diluting chemicals, we use a C1V1 equals C2V2 calculation. It's actually fairly simple once you get the hang of it. I do it in the laboratory almost every day. But I'm just going to go over it with you guys real quick here. So C1 is your initial concentration, and that should always be 100%, which is your 100% essential oil. Now your V1 is your initial volume. So that's the amount of drops you're using of your essential oil, and that is unknown because we don't know how much we want to use in order to have a 2% concentration. So because we don't know what our initial volume is, I'm just putting question marks here because that's what we're going to calculate. So assuming we're diluting, let's say we're going to make an essential oil roller, a 10 milliliter glass roller, let's say, for an adult. So our final concentration, we want it to be 2% because we're trying to dilute it for an adult. And because we decided we're making a 10 milliliter essential oil roller, that will be our final volume. So because we want to find the initial volume, we're going to be putting our initial volume at the start of our formula here. And because we have both values for C2 and V2, we're putting them at the top of our equation. So far we have V1 equals 2% multiplied by 10 milliliters. And then because C1 is our leftover value, C1 is going to go on the bottom of our equation, which is our 100%. Now, 2 times 10 is 20, divided by 100 is 0.2. And because we're talking about milliliters with our volume, the amount of essential oil we're putting in our 10 milliliter bottle will be 0.2 milliliters. Now, I know that can seem extremely confusing and overdone, but a general rule is 6 drops of essential oil for every 10 milliliters. So that makes it a lot easier instead of doing a calculation like that. With a calculation, you can determine any amount at any time instead of going by 6 drops per every 10 milliliters, because if you're working in large quantities, it might take you a long time to figure that out. But to make it nice and simple, if you're just using it at home and things like that, generally you are using smaller quantities, and a lot of the time when you're using essential oils at home, you are using quantities as small as 10 milliliters. So you should be putting 6 drops of that pure essential oil into your 10 milliliter roller, and then just filling the rest with a carrier oil, such as olive oil, jojoba oil, coconut oil, things like that. Now, let's talk about contact dermatitis and essential oils. So I know I was kind of throwing the word around earlier, but I didn't exactly describe what it was, but I'll go into it now. So contact dermatitis is that red inflamed skin condition that I was showing like in that patch test photo. So contact dermatitis is a delayed allergic reaction occurring 24 to 72 hours after exposure. These are the most common essential oils that result in contact dermatitis. So tea tree oil, ylang ylang, lemongrass, sandalwood, clove, and especially jasmine. Jasmine is very volatile like that. And like I said before, if you are experiencing severe cases such as open wounds due to this contact dermatitis, or anaphylactic reactions, like allergic reactions to these chemicals, you should definitely be seeking immediate medical attention, whether that means driving yourself to the hospital, calling an ambulance, getting someone else to drive you. Either way, if you have an open lesion or you're having an allergic reaction where you cannot breathe, you need to seek medical attention immediately. Now, contact dermatitis is very annoying, yes, it can be painful. So here are some ways to treat and prevent it. So you always should be diluting your pure essential oils with a carrier oil, like I had said. If you're creating products or just working with pure essential oils, you should be wearing gloves when handling them, because you do want to avoid that contact dermatitis, as well as contaminating other areas where someone else might lean on and pick it up on their own skin. You should always, always, always use your oils in a well-ventilated area. I cannot stress this enough. They are very, very potent chemicals. I know they smell nice, but a lot of them do irritate mucous membranes and things like that, which I'll go into in a moment here. You should also wipe down surfaces after use. In case of spills, obviously, because if you have children around or pets or even other adults, if you spill your pure essential oils, like on a counter, for example, someone could easily come along and set their hand down and then put that in their mouth or in their ears, their eyes, things like that, and it's just as bad. And you can also treat your dermatitis with over-the-counter topical corticosteroids, and always seek medical attention for severe injuries, and you might even need antibiotics if you have open lesions due to your contact dermatitis. So if you're having severe reactions, definitely see a doctor. Now, one of the methods that I had mentioned earlier was diffusion of essential oils, and that is when you have a little device and you fill it up with water and it plugs into an outlet, and you add your essential oils into the device. And once you turn it on, it creates a vapor which diffuses into the room. A lot of people use them as like air fresheners or just to keep their home smelling nice. You should definitely always diffuse in a well-ventilated area. So no small rooms or closets or things like that. It's best used in like a large bedroom or a living room, things like that. You should diffuse them in cycles of 30 to 60 minutes on and 30 to 60 minutes off. I know a lot of people just leave them running continuously and just fill them up as they run out of water, but in reality, you should be diffusing them in cycles. And I say diffuse them in cycles because even though diffusion is commonly thought to be the safest method, like I've said before, some essential oils are mucous membrane irritants. Also, if you have pets, you should allow the pets the ability to leave the room if they want. So you should leave a door cracked open or have some route of escape if the pet is feeling overwhelmed by the scent. Now, talking about humans again, some of the mucous membrane oils that are very irritating commonly are bay, cinnamon bark and leaf, clove bud and leaf, lemongrass, peppermint, and thyme. So essential oils should be used with caution, especially these ones, when diffusing especially, because once the essential oils are diffused into the air, they can go into your nasal cavity and attach to this nasal mucosa and really irritate it. You can get sinus infections or other respiratory issues. Another great way to prevent contamination and things like that, always wash your hands after using your essential oils. Even if you're just filling up your diffuser, you might have gotten some on your fingers. And if you're washing your hands, this is great because it avoids contact with your mucous membranes, such as your nose, ears, eyes, and mouth. So if you have it on your fingers and you go to scratch your ear or you rub your eye or your nose, you can get those essential oils in that nasal mucous membrane, and it can be really irritating. And it prevents the contamination of surfaces where small children and animals touch. So like I said before, if you could spill essential oils on your counter or anything like that, children could easily come, and you know how children like to touch everything. They could easily pick up some essential oils on their hand, put it in their mouth. It's not good. Like I said before, you shouldn't ingest essential oils at all, and I'll be getting into that in a moment here. Essential oils are very dangerous to consume. They absorb very rapidly orally, and they can cause toxic effects in as little as 30 minutes, which can permanently affect your health and be fatal. Do not consume these chemicals, please. If you consume an essential oil, you are quite literally poisoning yourself. And these are some of the signs and symptoms to look out for essential oil toxicity or poisoning. Drowsiness, shallow breathing, seizures, wheezing, nausea and vomiting, skin irritation, eye redness, and if consumed in a large quantity, not to put essential oils in your mouth. Do not swallow them. Do not even put them on a toothbrush and use it for brushing your teeth. I don't care. It could end up in your stomach. You could get toxic effects. You could get permanent damaging health effects from consuming essential. And I'm not going to say any of those multi-level marketing companies who will market these essential oils as completely safe and natural, and therefore they should be able to be consumed. But I'm telling you right now, these are very potent chemicals. Do not put them in your body. Now, in case of an essential oil overdose, whether it be accidental or you purposely put it in your body for some reason, please rinse your mouth immediately with water, but do not swallow. You need to phone your poison information center right away, and they will give you instructions on what to do. But you should never induce vomiting because it increases a risk for aspiration into the lungs. You could choke on your vomit and die. You should also not drink anything until you are cleared from your poison center. Like I said before, you can rinse your mouth with water, but do not swallow anything until you are cleared. And of course, seek medical attention if your overdose is severe. So that would be like not being able to breathe, extreme nausea and vomiting, seizures, things like that. If someone's going unconscious, choking on their vomit, things like that. It can be very, very serious. You should definitely call an ambulance right away, especially if your poison control center is telling you to. And now I'm going to talk about those hormonal imbalances or disruptions like I was talking about at the start of my presentation. So I'm going to be going over something that's common with both males and females in the next two slides, and both have been documented with using lavender and or tea tree essential oils. So a study found from the National Institute of Environmental Sciences in 2007, which was also backed up by another study by the same institute by different people in 2018, showed that repeated topical use of lavender and tea tree oils resulted in enlarged breast tissue in prepubescent males. So, males who had not yet hit puberty were developing breasts. It's been determined that lavender and tea tree oil are potentially endocrine disrupting chemicals, which have both estrogenic and antiandrogenetic effects. So, estrogenic is when your body is producing lots of estrogen. Antiandrogenetic means that it's a chemical that's inhibiting the synthesis of testosterone. So basically, for these prepubescent males, these chemicals were making their bodies stop producing testosterone, and the estrogen was just way out of balance. There was too much estrogen, and the body was no longer making testosterone. And the enlargement of breast tissue in prepubescent males is called male gynecomastia. Now, if we're talking about females and hormonal imbalances related to these essential oils, it can result in something called female premature thelarche. And female premature thelarche is a medical condition characterized by isolated breast development in females younger than 8 years old. And the highest rate of occurrence for female premature thelarche is actually in females 2 years of age and under. So there was literally female babies developing breasts because of these essential oils being applied topically by their parents. So there is supporting evidence found in a third 7-year study linking lavender and tea tree oil to the disruption of the hormones causing these things. And this third study was published in the Journal of Clinical Endocrinology and Metabolism in 2018. So now that I've gone over a couple essential oils and possible health effects, I'm just going to go over a couple more and their various side effects. And by the way, for most of these following oils that I'm going to be talking about, the risks are being applied, used either topically or ingested for the most part. There isn't very many health effects related to diffusing unless it's related to respiratory issues and that mucous membrane. So, when using anise, you should be aware that it decreases the effectiveness of your antidepressants and antipsychotics. Just as, for example, cannabis use decreases the effectiveness of antidepressants and antipsychotics. Very similar effect. It also increases the effect of drugs that affect the central nervous system. So if you're on a prescription for your central nervous system, you should definitely be consulting your doctor because the dosage will matter. Now, bergamot, like I had said before, is a photosensitive essential oil. And it can cause skin sensitivity and burning. If you put this oil on and you hop in a tanning bed or go outside on a hot sunny day, you could result in second and or third degree burns, for sure. Cinnamon is a pretty dangerous essential oil as well. It is a mucous membrane irritant. You can get contact dermatitis. If ingested, you can get double vision as well as nausea and vomiting. Eucalyptus is one to watch out for as well because if ingested can cause very severe seizures and coma and poisoning. Now, lavender, like we said before, affects hormones in adolescence. And if you recall about the female premature thelarche, it also affects females as young as infants, where infants can develop breasts. And it's also not to be used with males who have not yet experienced puberty. Like I said before, the males were developing breasts due to the topical use of lavender and tea tree oils. Now, nutmeg, if applied topically, may cause a rash or a burning sensation. If ingested, probably will cause hallucinations. And not the fun kind of hallucinations, like the poison type of end up in the hospital kind of hallucinations. Now, sage, if ingested, will cause vomiting, vertigo, tachycardia, which is a very increased heart rate, tremors and seizures, very serious, as well as kidney failure. Definitely do not ever, ever, ever ingest sage, ever. And again, tea tree oil causes hormone imbalances. If ingested, will cause confusion and loss of muscle coordination, which could be permanent if not treated. Tyler Ramsey, a research fellow at the National Institute of Environmental Health Sciences, says, "Our society deems essential oils as safe. However, they possess a diverse amount of chemicals that should be used with caution because some of these chemicals are potential endocrine disruptors." So I guess what I want everyone to take away from this presentation is not to believe everything that these multi-level marketing essential oil companies are telling everybody. You should not be consuming essential oils. You should be very careful with them when applying them topically because it could cause burns, contact dermatitis, and hormonal imbalances, which causes development of breasts in children. You should always dilute your essential oils, 1% for children, 2% for adults. And if you're ever in doubt, you can always do your own research. Look up medical journals. Don't go to these websites with news articles related to these things because news outlets are not reliable sources. You should always be looking at scientific evidence. So, science over marketing. Please, please, please. If Young Living, doTERRA, anything like that is telling you it's completely safe to ingest their products, I'm telling you, don't do it. If you can get such severe side effects just applying essential oils topically, why would you ever put that in your mouth and swallow it? Why? It just doesn't make sense. It's not safe. Do not do it. Ever. And I know the marketing, I know essential oils are 100% pure plant extract. That means they must be natural and organic and safe because they come from plants. But let's remember, through steam distillation and even solvent extraction, they're using chemicals to pull chemicals from plants. And even though these plants may be safe in nature, once you have extracted plant material in a pure form, it is very highly potent. It's a very strong chemical. And as we've gone over, it can cause burns and all sorts of great side effects. So just remember, once essential oils have been extracted from plants, they are no longer the same. They are a completely different chemical composition than they were just as they were as a plant planted in the ground. Extracting essential oils is a completely different process. You are condensing something so strongly, it's very potent, okay? So please be safe when using essential oils. I hope you follow all these words of advice I have provided. And once again, thank you very much for attending this essential oil safety lesson. My name is Katrina Dow, and I am a certified aromatherapist, as well as I have experience in biotechnology and medical laboratory science. So I am a professional. I have spent years and thousands and thousands and thousands of dollars to be able to provide this information for you to keep you safe. So I really hope that you trust me over these multi-level marketing companies that are just trying to get your money. All right, everybody, I hope you enjoyed the presentation. Please be safe when working with essential oils. Once again, if you have any questions you'd like me to follow up with you on, you can place them down in the comments section. I will get back to you, as well as you can always email me at bodhichakraaromatherapy@gmail.com, and I will get back to you as soon as possible. So thank you everybody so much, and I hope you do recommend this training to your friends and family, and hopefully you learned something today. Thanks guys, have a great day.